Hi guys, this is Remya Renjan working as an assistant professor in Biyani Institute of Science and Management. Today on behalf of Guru KPO, today I am going to take topic on Apgar Score. So here it is, the Apgar Score. Then it is invented in 1952 by the doctor anesthesiologist, which his name is Virginia Apgar. So next, the Apgar score is a scoring system which ranges from 0 to 10. In Apgar score, the score ranges from 0 to 10 and is calculated by evaluating the newborn on the basis of 5 criteria. Apgar score में क्या होता है, 5 criteria present होता है और जिसके basis में हम जो newborn के का जो एक टोटल स्कोर दिया जाता है जो कि रेंज होता है 0 to 10 के बीच में. और नाउ लुकिंग अपॉन द क्राइटेरियाज वी कैन से देखो द क्राइटेरियाज आर कलर ऑफ द न्यू बॉर्न, heart rate of the newborn, reflex irritability of the newborn, muscle tone of the newborn, respiratory effort of the newborn. So these are the 5 criterias which are taken after birth of the baby. So for these 5 criteria we have given certain score, that is 0 to 2 for color, 0 to 2 for heart rate, 0 to 2 for reflex irritability of the newborn, 0 to 2 for muscle tone of the newborn, and 0 to 2 for the respiratory rate of the newborn. And the total sum of these criteria will be the total Apgar score, which ranges from 0 to 10. So these are all about the Apgar score ratings. Then the word Apgar or the criteria can be remembered by the mnemonic word Apgar, that is APGAR. A for appearance, that is color of the newborn, the first criteria. Next P for pulse, that is heart rate of the newborn. Then G for grimace, that is reflex irritability of the newborn. Then A for activity, that is muscle tone of the newborn. And R for respiration, that is respiratory effort of the newborn. So these are the mnemonic sound Apgar and the meaning of this, by which we can remember the Apgar score easily. So we have looked at Apgar score, which is invented in 1952 by Dr. Virginia Apgar, and the score rating ranges from 0 to 10, which is taken after the birth of the baby. Then calculating the by calculating the evaluating newborn based on the 5 criteria. The criteria are color, heart rate, reflex irritability, muscle tone, respiratory rate, and after that we can take the all sum total, which gives the total Apgar score of the newborn. The Apgar score that can be taken after 1 minute, after birth of the baby, after 1 minute, then after 5 minutes, then if the score is low, then we can take after 15 minutes of the Apgar score. So these are all about the scoring of the or rating of the Apgar score. Now let us see the scoring of the Apgar score. As we all know that it is scored from 0 to 10. If suppose, if for example, if the score came 7, 10 to 7, then it will be the normal score. Then if the score came from less than 7, it will suggested that fetal stress, for that we have to take the suction and all. If the score came 3 suppose, so it is the very bad score and it will indicates the neurological defect of the newborn. And this is the very bad score. So these are about, according to the score of the newborn. Then what are the, we can say the purpose of the Apgar score is to determine when emergency intervention is needed. Apgar score क्यों लिया जाता है? ताकि हमें ये determine किया जाए कि emergency जो intervention है वो कब लेना ज़रूरी है for the after the birth of the newborn. Now these are all the criterias for taking the score of the Apgar. As we all know that for A, which is appearance, if the newborn is blue or pink in appearance, then if the newborn is blue or pale in appearance, then we will give 0 point. If the newborn's extremities are blue but the body is pink, then we will give 1 point. Or if the body and the extremities both are pink, then we will give 2 points. Then next, pulse. If the newborn's pulse is absent, then we will give 0 point. Then if the newborn pulse is less than 100 beats per minute, then we will give 1 point. Then if the newborn beat is more than 100 beats per minute, then which is ideal, then we will give 2 points. Then next is the grimace. If the newborn have no response to the stimulus, then we will give 0 point. Then if the newborn is aggressive on stimulation, then we will give 1 point. And if the newborn has good cry on, then we will give 2 points. Next, activity. If the newborn has no activity after birth, then we will give 0 points. Or if there is some flexion of the arms and legs after birth, then we will give 1 point. And if the newborn is active against resistance after birth, then we will give 2 points. Then coming to the respiration of the newborn, if the newborn's respiration is absent after birth, then we will give 0 points. If the newborn's respiration is weak, irregular and slow, then we will give 1 point. And if the newborn is having the strong cry, then we will give 2 points. So these are the scoring systems of the Apgar score. So these are all about Apgar score. Thank you and thank you.